Hello everyone, in this video we are going to talk about aortic dissection in pregnancy, or you can read that aortic dissection in pregnancy. Okay, now what are the reasons of aortic dissection? It is usually happen at late pregnancy, but what are the reasons? So bicuspid aortic valve, aortic coarctation, Turner syndrome, Ehlers-Danlos syndrome, Marfan syndrome. You see here there is some problem with collagen tissue. So this is why aortic dissection can happen because of this. If you talk about Marfan syndrome in pregnancy particularly, the risk of aortic dissection is increased. Aortic root, whenever you do a 2D echo of heart, what will you see? The size of aortic root. If it is more than 4 centimeters, there is a higher risk of aortic dissection. If it is less than 4 centimeter, outcome is generally good. Okay, pregnancy increases five-fold risk of aortic dissection or aortic complications. Now, management of aortic dissection. You know that what are the symptoms: systolic hypertension, differential blood pressure in each arm, urgent pain in chest. These are the aortic dissection symptoms. What you do, how to diagnose? There is a higher imaging required, CT, MRI, 2D echo required. Now, as a treatment to prevent aortic dissection, you should go for serial beta blocker therapy. If the aortic root is less than 4.5 centimeter, vaginal delivery can be preferred. But if the aortic root is more than 4.5 centimeter, then cesarean with epidural anesthesia should be preferred. So cesarean is preferred if aortic root is more than 4.5 centimeter. Okay, now, okay, what is EBM? If the aortic root is more than 4 centimeter, higher risk of aortic rupture can happen. In our videos, EBM will be always be evidence-based medicine. So this, I think, is enough discussion for a gynecologist about aortic dissection in pregnancy. Thank you, friends.